This is nutrition and supplements. It's part of our summer continuing education series. I'm Andrea Larson. I'm a mom of four. I'm a nurse practitioner, and I specifically practice cardiology. So I've become super passionate about cardiometabolic health and wellness. So that plays right into this whole sphere of how nutrition and smart supplementation really impacts our overall wellness and our development of chronic disease. Okay, so let me skip through here. So as you as we've done some of these other classes, we primarily focus on the ways that doTERRA can help us in these really specific areas. So we'll talk a little bit about why does cardiometabolic health matter, what can doTERRA help us with, and then I am actually part of a small group that is a test group for a new product release coming this fall. So I'm going to give you some inside tips and some inside information on the exciting stuff to come. So the question really is, for me, why are people so sick around us? Okay, this is really why I got into this area of more of a functional medicine, asking questions. I, graduated from nurse practitioner school. I thought I knew how to keep families healthy, but I was extremely frustrated because I couldn't even keep my own two children at the time healthy. And if I would have listened to what my colleagues wanted me to do, my son, who's 7 now, would be taking 3 medications every single day. And unfortunately, in the United States, that's becoming extremely common. We now have not quite, but almost 50% of children take at least 1 medication on a daily basis. And that is just setting them up for this snowball effect of the development of poor cardiometabolic health as they get older. For me, it started this cycle of, but why was this happening to my son? Why couldn't anybody tell me? Why does he all of a sudden have allergies that I need to treat? Why can't he sit still? Why can't he sleep at night? Nobody could give me any of those answers. So really, because of my son, the last 5 years I have spent researching, reading, and learning about this whole new side of caring for our bodies in the way that God designed us to care for them, to allow them to heal, which ultimately prevents and reduces your risk of developing chronic disease over your lifetime. If you're already in your 60s, you can't go back and redo, what you did 10, 20, 30 years ago, but you can pick up where you're at right now and start reversing the aging process by reducing the inflammation in our body and supporting good cardiometabolic health, like we'll kind of talk about in our class tonight. So what we put in our bodies is what we're going to get out of our bodies. So do you think that we get enough of the nutrients we need on a daily basis from just our food source? And the answer is no. Because of mass food production, I'm a farm girl. I come from a farm community, so I'm extremely proud of the fact that my dad is a farmer, and I support what he does. But because of the way farming and food production and shipping food from, all over the world, because of the way those practices have changed, the nutrients available in food today is significantly less compared to nutrients that were available in foods 10, 20, 30 years ago. A lot of different groups will reference the vitamin C content in an orange, for example. You'd have to eat about 8 to 10 oranges to get the same vitamin C content that one orange contained 20, 30 years ago. So that is why nutrition and then smart supplementation is so important, because our bodies just simply are not getting what they need to be able to function normally. And at a level where inflammation is not starting to compound and develop chronic disease. So the number one cause of death in the United States is cardiovascular disease. Despite what you have heard on the news, more people die from heart disease every year than all forms of cancer combined. But nobody talks about it. It's a big deal. You know, I love all the fundraisers and research money that's being poured into research for cancer. But heart disease is what kills people, and heart disease originates from poor cardiometabolic health. And recent statistics have actually shown that less than 10% of the US population, that includes children, have optimal cardiometabolic health. And we're talking like optimal, like healthy BMI, like a healthy weight, a healthy metabolism, a healthy cardiovascular system. So this is a really huge problem. In the United States, we get sick with chronic disease about 20 years sooner than any other country in the world, even though we have the best medical system. So our medical system is failing us because we do not talk about how important lifestyle, nutrition, and smart supplementation is in reducing these chronic diseases, because we're supporting our body in the way that God meant for it to be supported. Okay, so we've kind of talked a lot about this. So if you haven't seen doTERRA's wellness pyramid, I would encourage you to Google it, and you can see a diagram pop up. But nutrition is really the foundation of our health. It's estimated that 90% of chronic diseases are actually indirectly or directly connected to a nutrient deficiency. So smart supplementing, eating healthy whole foods that aren't processed, don't have chemicals in them, allows our body to really function optimally. You can see the benefits of supplementing correctly really quickly, actually, with increased energy, increased mental clarity, improved mood, less pain, and doing all these things supports our cardiovascular system and supports a proper inflammatory process. So the development of, coronary artery disease is the #1 cause of death in the United States, but that process actually starts as early as our teens, and it is because of inflammation. When we have inflammation in our blood vessels, it makes our blood vessels sticky. And when they're sticky, plaque, cholesterol can stick to the inside of our blood vessels, and we develop what's called atherosclerosis, or hardening of our arteries. Hardening of our arteries is what ultimately leads to the blockage in our heart arteries, that coronary artery disease, or blockage in our neck arteries or our leg arteries. That inflammatory process that leads to those blockage starts all the way back in our teens because of our diet, our lack of stress management, poor sleep habits, and toxic load, different medications that we're giving our kids. All of these things have health implications, significant health implications later in life. So doTERRA's #1 selling product is their Lifelong Vitality Pack. This is doTERRA's supplement pack that literally has everything that you need to support your nutrition, all in this convenient 3 supplement pack. So I'll break down what is in this pack and how these 3 different supplements work, and then go through kind of what they do. So with this, if you're taking the full dose, it's actually the equivalent of 12 servings of fruits and vegetables. I really try to push the fruits and veggies hard in my house, but I know that we don't even get to the servings of veggies that we need. So I love that Lifelong Vitality can support us in getting those micronutrients from the vegetables into our diet. So the Lifelong Vitality Pack is made up of the Microplex VMZ, Alpha CRS, and the XE Omega. So the Microplex VMZ is their whole food nutrient complex. This would be like a multivitamin swap out. What makes this different than the multivitamin that you can buy at Walgreens or Target is that this is made from whole foods, which means that it's the real thing. Other vitamins are synthetically manufactured, so they're the synthetic form of what your body needs, just like most prescription medicines are the synthetic form of something naturally found in nature. This whole food nutrient complex is the real form of the micronutrients that your body needs to function optimally. If you were to open that capsule up, a powder would fall out. And because it's in a powder form, it's the real thing, your body recognizes those molecules and that nutrients and knows what to do with it and can absorb it very easily. And because it can be absorbed so easily, you notice the benefits. I remember I, really never took a multivitamin unless I was pregnant, but anytime I took a multivitamin when I was pregnant, I didn't notice anything. I just felt nauseous from swallowing that compressed horse pill. So I love that it's something my body recognizes and I can tell when I take it. The second of the trio is this Alpha CRS, which is the Cellular Vitality Complex. Okay.
Wendy.
Yes.
Are there supposed to be slides? We're not seeing the slides.
Am I not sharing my screen with you guys?
I think so.
Thanks for saying that. That's okay. I thought I was sharing my slides with you guys. Here I am just yakking away. I'm sorry. I'm glad you finally said something. Good gracious. All right, can you see my screen now?
You do.
Perfect. Get this bigger again. Okay, how's that? Okay, so we talked about that one in the middle, the Microplex VMZ. And then the Alpha CRS, this is their Cellular Vitality Complex. So this is what I describe as like the inflammation reducer. And I never really heard much about inflammation until COVID hit about 2 years ago. And we knew in the ICU that patients who had inflammatory diseases were the ones that actually did the worst. Our respiratory patients were actually the ones who didn't do as bad as patients who had hypertension, type 2 diabetes, and obesity. Those are the top 3 risk factors for doing very poorly with COVID, because those 3 disease processes are directly linked to significant inflammation in our bodies. And the Alpha CRS reduces inflammation. And then, of course, the XE Omega, this would be like your fish oil swap out. So it's omegas that are encapsulated in a special capsule that helps preserve their potency. And it's the correct omegas that we need, not the ones that we get bombarded with that actually can be more harmful. And then this is, of course, infused with essential oils as well, like wild orange and frankincense, that help with different cellular processes as well. So Omegas are really great to take for brain health. They can help with focus, with memory. It's also really great for your heart, because taking an omega every day actually can improve your blood pressure. So it can reduce inflammation. It also helps improve knee or joint discomfort, can help improve your skin, all sorts of different things. Fish oil is really something that everybody should be taking, especially children, because our bodies do not naturally make omegas. And unless you are somebody who loves fish, which I really do love salmon, we try to eat it once a week, but it's not cheap. We don't get any omegas in our diet anywhere. So taking a fish oil is actually a really, really important supplement to be on. So I love how convenient this pack is. Even though I've actually tried, I think there's a lot of good supplement companies out there. I'll just be totally honest with you guys. I think there are some that have good absorption. I think there's some that can help fill in different gaps. I always recommend Lifelong Vitality, though, because of how cost effective it is. If you guys look at the ingredients in what's in these 3 supplements, it would cost you so much money to try to piece together what doTERRA puts together in this pack. It's way more cost effective to take Lifelong Vitality because of its absorption and how many ingredients compared to any other brand that I've looked at. I will also say I have only experienced benefits from Lifelong Vitality. I have taken other expensive supplements that you actually have to be a medical provider to be able to prescribe. And this is probably TMI for most of you, but it turned my urine neon yellow. I was like, it looked like my toilet was full of like highlighter ink. And so if you are taking a vitamin that is making your urine look like that, just stop taking it, because your body is literally filtering everything out and you just have expensive urine. Your body isn't using it, even though it's expensive, even though maybe your chiropractor or your functional medicine doctor is telling you to take it, your body isn't using it. And your body will use Lifelong Vitality. I have never experienced that with Lifelong Vitality. I only have experienced the improved mood, the improved focus at work, the energy that I need to be able to get through the day working and having a side business and having 4 kids, and we're moving right now. This is my new office, by the way. I have no walls yet, but someday I will. And all these different things. I've only experienced benefits from taking Lifelong Vitality, but I've never experienced watching my body just eliminate it. So even though Lifelong Vitality is about $80 a month for the full dose, when you actually go and look and compare cost effectiveness, it's not even close. You could easily spend $250 to $400 a month to get what's in Lifelong Vitality. So it's extremely cost effective for what you get. Okay, so at this point, if you're watching the recording, you can pause the video, or if you're joining us live, I would just encourage you to reflect really, why did you start with doTERRA? Like, why were you interested in getting into this? I was just like desperate for my kids to not be sick all the time. I was missing so much work. We had tonsils out, we had ear tubes put in, I was doing breathing treatments in the middle of the night. My son wouldn't sleep, he wouldn't sit at the table, he'd run laps, and I was like, I'm supposed to be able to keep other people's families healthy. I don't even know what to do with my own child. I was like, I thought oils were a scam, I'll be honest with you, but I was so desperate, I was willing to try them. And I thought taking a multivitamin was like, why? And, I eat well. I don't need that. I had no clue that my son was so severely nutrient deficient. I had no clue how desperately I needed Lifelong Vitality for my skin, for my mood, for my brain fog and energy levels. doTERRA has been such a beautiful gift. Their supplements have been such a beautiful gift. Everybody needs to be on this Lifelong Vitality just for basic foundational health. Okay, so let's review. I kind of told you a little bit about my story, but so if you haven't started Lifelong Vitality, or maybe you took it once and you quit taking it, please start taking it again. Foundational stuff every day, everybody should be taking is Lifelong Vitality, Terrazyme, and PB Assist. Terrazyme is their digestive enzymes. If you take one or two of those with your Lifelong Vitality, it actually helps your body, helps to improve the absorption. So even a better absorption of the Lifelong Vitality. It also helps with digestion because it actually breaks down food in your digestive tract. If you were to open a capsule of Terrazyme and pour it on a bowl of oatmeal, you could watch it digest the bowl of oatmeal. So we all have digestive enzymes from our pancreas, from our gallbladder, but most of us are actually deficient in digestive enzymes. So if you have bloating, acid reflux, if you don't have a gallbladder anymore, Terrazyme will change your life, promise you. I think Rachel Morehouse is on here and she can attest to that. PB Assist is their probiotic. It has 6 different strains of marine probiotics, and is this beautiful like green capsule. And I've been doing some GI map testing on some different clients, and the clients who are taking the probiotic, like their normal gut bacteria looks phenomenal on their test. So it definitely really steps up to the plate and does the job. Just taking a probiotic every day can reduce your risk of developing high blood pressure during pregnancy by 50%. That is huge. And there was a study done in the New York school system. Kids that took a probiotic every day were 75% less likely to require an antibiotic during the school year. So if you do not take a probiotic every day, you need to. Your gut, your health, your blood pressure, your inflammation, your cardiometabolic health will thank you. And then I would recommend just adding citrus oils to your water. You can start with wild orange, lemon, lime, grapefruit's one of my favorites, very sweet tasting. And then if you're feeling overwhelmed, just put your oils by where you fill up your water cup. And then you fill up your glass, make sure you're drinking out of glass or stainless steel. When you fill up your glass of water, put a drop of your oil in and drink it, okay? Second is rest and stress management. So one of the top 3 causes of cardiovascular disease is stress. Did you know that? Stress causes cardiovascular disease. So if you are not managing your stress, you need to start taking it very seriously. Lifelong Vitality Pack can help tremendously. Depression is so overdiagnosed. Over 50% of the time, depression is actually a nutrient deficiency manifesting as depression. And you can actually get off your depression medications if you just start taking Lifelong Vitality. Frankincense is great for your mood. It's great for inflammation and general cell health. Balance is doTERRA's grounding blend. You can put that on the bottoms of your feet when you start the day. Some people like it for panic attacks. If you feel on the back of your skull, there's a divot back there. Right back there is a really great place to put oils to help support your neurotransmitters, your CNS, your central nervous system. Putting oils right there is a really quick way to get oils through your skin to your brain stem. So if you have a child who's like really worked up or having a temper tantrum, a drop of oil right in that nook right there, that little crevice, is a great place to put oils, and then of course hug and pray. Lavender is kind of known as the most calming oil, and that's because it has linalool in it, and linalool is the organic compound that causes these relaxing feelings when we smell it. But one oil I want to add to this list is magnolia. If you don't have magnolia, magnolia actually has an even higher content our linalool content than lavender. So it's even more calming than lavender. Magnolia is kind of being called the new lavender because of how much linalool it has. So definitely try Magnolia if you struggle with shutting your mind off before going to bed, or like stressful moments, kids with temper tantrums or mood swings, all those sorts of things. Magnolia is a great oil. Then of course our Serenity oil, and then the Serenity soft gels. So there was a double-blind study done. That means the person giving the products and the volunteer, nobody knows what anybody's getting. And they compared an anti-anxiety medicine that's very popular and lavender. And the participants who took lavender reported the same amount of anxiety and depression symptom reduction as the patients that were getting the synthetic anxiety medication. So lavender is a very powerful way when taken internally, and there's 4 drops of lavender in a Serenity soft gel. Lavender is a very powerful way not only to support sleep, but to support reduction of anxiety symptoms. And of course, the adaptive soft gels and the adaptive oil, it's a really beautiful combination of products that help. They work on our dobutamine and serotonin in our brain. So it can be very, very calming and relieve stressful feelings. But it can also help improve focus, mood for kids that have ADD and ADHD. I'll come back to exercise and weight management because that's my secret little inside information. And then reducing your toxic load. So it turns out that Lysol and Clorox and Tide and wallflowers and wax and antiperspirant deodorant and all these things are really bad for us. They are what we call endocrine disruptors, which means they alter our body's estrogen levels. Okay. The number 1 form of cancer is lung cancer. The number 2 form of cancer is breast cancer in women and prostate cancer in men. Prostate cancer and breast cancer are hormone cancers. The reason that these cancers are so common is because we have so many things in our life that disrupt our hormones. And all these products that are on the shelf that we are just to assume that we're safe, like SC Johnson, a family company, their products are poisoning our children. They're poisoning our grandparents. And those changes in hormones are being passed down through generations. It's called epigenetics. It's very interesting to learn about. And so it does really matter whether or not you have a diffuser or a can of Febreze in your bathroom. It does matter how early these kids are developing or going through puberty. It matters because of the rates of infertility. They're skyrocketing. It matters because of how early people are developing cardiometabolic syndrome. These things matter because even in small doses, what may not seem to cause a problem over the course of a year, over the course of 30 to 40 years, this is why we are having so many health concerns in the United States right now. I'll get off my soapbox. I had no idea. I had no clue that my Scentsy pots in every single room in my house was giving my son asthma. I had no clue. Nobody ever asked me what I was putting in the air in my home. They just told me to stick him on an allergy medicine every day and do breathing treatments at night. There was no investigative medicine. There was no, let's figure out why this is happening. It was just, here, this is a pill that will quick fix your problem. And we need to stop looking at chronic disease as managing it and start looking at why is this happening and what do I need to do? What work do I need to put in to make a change so that I can start reversing the clock on my cardiometabolic health? That leads me into exercise and weight management. So I got chosen as one of 12 people who gets to try out doTERRA's brand new product line that is dropping in September this year. I cannot tell you what it is, but I can talk about it. It is a 5-product series that will help with supporting optimal cardiometabolic health and weight management. So excited about this. I've been using the products for 4 days now, and I am just really, really loving them. I haven't weighed myself yet, but I felt like I've had more focus at work. I haven't needed to have something sweet after lunch. I feel full. I feel energized. I have been sleeping well at night. And I'm so excited that this is like this missing piece that doTERRA has had for so long. And it's the result of an incredible clinical trial that doTERRA did with just staggering results. And I'm so excited for you guys to learn more about it this fall. I think doTERRA will continue to drop little hints about what this product line is and what it can do and what it's called. And it's going to be absolutely incredible. But right now, I would definitely recommend adding copaiba and turmeric and even the deep blue polyphenols into your daily routine. Copaiba activates your endocannabinoid system, which is the same thing that CBD activates. But of course, CBD, like 80% of CBDs have a different THC level than what they report. So you can actually lose your job as a truck driver if you get randomly drug tested and you're using CBD for knee pain. And so copaiba does the same thing. It actually works a little bit better because of it's a direct agonist versus an indirect agonist, which is all organic chemistry. But anyway, it's a great alternative. It is great for your cardiovascular system. It's good for your blood pressure. It's a very calming oil. And turmeric reduces inflammation. It makes you more sensitive to the insulin your body's already producing, which can help with improving our metabolic health. It can help with weight loss. And of course, it helps with pain management. Turmeric is also very great if you are struggling with the after effects of COVID. It helps your immune system basically turn over. It helps to kill off the cells that are still sick so that you have healthy cell production. Okay. Okay, so if you're like, I just got fire hosed by Andrea, the nurse practitioner. I don't even know where to start. Just grab a glass of water and some lemon and add a couple of drops of lemon to a glass of water. It's a gentle detoxer. It tastes great. It'll help improve your hydration. And it's just a very easy way to start implementing some different changes to support your body. Okay, if you're going to start with Lifelong Vitality, which everybody watching this class should be adding it to their LRP right now. Start slowly though. So there's those 3 bottles. The full dose is actually 4 tablets of each of the 3 bottles. And I want you to just start with 1 of each of the 3 bottles for like a week, and then move to 2 of each of the 3 bottles thereafter. And then you can kind of assess where you're at. My husband and I actually just take 2 a day. We just take half the dose. And I feel really great with just half the dose. If you have a significant autoimmune condition, or like if I feel like I'm getting sick, I'll ramp up to the full dose. But that's what we do. And I feel I feel good. I feel like I'm getting the benefits. But you can kind of see where you're at and kind of go from there. And then make it a lifestyle. You know, it's hard. If you're constantly waiting for Monday to start your diet, you're never going to get anywhere. Okay. It's okay if you have a bad day, just do better tomorrow. Make it a lifestyle. Make it, I always want to make better choices, but it's okay if I go out with my friends for supper 1 night a week. If you can make it your routine, I mean, most of us have the routine of brushing our teeth every day, right? Make it your routine of, in the morning, I brush my teeth. On the way out of the house, I grab my Lifelong Vitality and I take my Lifelong Vitality. So I actually buy the here a couple slides ago, I'll show you. So this showed the picture of the bottles, and you can get Lifelong Vitality like that. If you pay just a little bit more, you can get it in a pre-packaged sachet. And I wish I had one of here to show you. But anyway, the sachet comes with 2 of each of the 3 supplements in it. And for me, like, I'm always running 5 minutes late, as you all witnessed tonight with the Zoom call starting 10 minutes late. It helps me stay consistent with my Lifelong Vitality because I can just grab it. All 3 of the supplements are in there and I can head out the door. I mean, what a first world problem to not have time to open up 3 bottles, but it really helps me stay consistent. So I get the sachets of the Lifelong Vitality. And then keep at it. Stay part of this community. Continue to educate yourself, because the more you learn, the more empowered you're going to feel to care for yourself and to care for your community. The longer you take these supplements, the longer you use your oils, the more you will experience the maximum amount of support that really can come from this lifestyle, which includes reversing your cardiometabolic clock. Okay, so this has a sample LRP. I actually thought I would show you my doTERRA order. And I think I still have it up from when I taught this class earlier this evening. Sandy, you were the only one logged on. So you were logged on listening to my recording. Anyway, so I'm on my account. You can see here, here's my loyalty reward order. And so I'm going to just click update products and show you what's in there. So this is what I get every month. I have my Lifelong Vitality sachets in there. And then when you add the Lifelong Vitality pack or the sachets, whatever you want to do, to your cart, you have the option of clicking this customize button and getting additional supplements for a reduced cost. So this is the cheapest way to get the probiotic, the PB Assist. You can get this Mito 2 Max. This is like what you could take instead of having coffee or an energy drink or like a pre-workout supplement. This Mito 2 Max is a really great specific energy supporter. You can get extra of the whole food nutrient, the Microplex VMZ. You can get extra omegas. I get a bottle of omegas extra. They're actually pretty tiny. And so my kids can actually very easily swallow these. So this is actually what I use as the omega for my children. And you don't burp fish oil. I remember my mom would give me some castor oil or something when I was a kid. She was way ahead of her time on omega supplementing, but I would always burp fish oil. I never do that with this. You can get some of the kids' vitamins, the Terrazyme, which is those digestive enzymes I talked about. You can add that on. And then these deep blue polyphenols. This is what we take at our house instead of Tylenol or ibuprofen. Some people, if you have chronic pain, you can take these every day to actually reverse aging because of what they do to free radicals in your body. Free radicals are what cause some of these inflammation things and the development of coronary artery disease. So deep blue polyphenols are awesome for metabolic health, cardiometabolic health, general pain reduction in general, and slowing the aging process. So these are usually $45 and you can get them for just $25 if you add them onto your Lifelong Vitality pack. So I get a bottle of those almost every month. So I kind of flip around, but the cool thing is every month you can choose something different. You don't have to get the same thing. So that's what I do. And because I add the 3 on and with the Lifelong Vitality pack, my PV is over 100. Over here, you can see it's 105, which means that my shipping is going to be free. And because I've been on the Loyalty Rewards program for more than a year, I'm actually getting 31.5 points back. So I'm getting $30 back in points that I can use. I use my points pretty regularly. So right now I just have 67, but because I get my vitamins from doTERRA and our laundry soap, and like I swap out all my products and use doTERRA's cleaning stuff and toothpaste and all those things, I actually just use my points to get my oils for free. So instead of buying this stuff at Walmart, I buy it from doTERRA. They give me free shipping, they give me points back, and then I can get my oils for free. So I don't need this until August, so I'm just going to click save and process. But if you wanted to, you could click proceed to checkout, and then you could purchase it tonight or right away, and it would be sent to your house. And then your loyalty reward order would kick out until August and wouldn't process again until then. Okay, let me get back to this screen. So if you, that order was 105 PV. If you add a couple extra things like a toothpaste or a lemon, I mean, you could get to 125, which is the threshold for getting the free oil of the month. This month it was cypress, which is great for varicose veins, ladies, on the legs. And it's great in a pain roller. So you can get the free oil of the month as well, just by adding a couple extra products. Okay. So there are usually 3 types of people that come to this class. Most people they want a healthier lifestyle. They want to get healthy and stay healthy. They love doTERRA's products. They love what the company stands for, the philanthropy. And they just love to continue to educate themselves and learn more about how to care for themselves. But there might be some of you on here who are like, I can think of a few people just in my family that they need this lifelong vitality pack. They need this. And maybe you just want to share with a few people, and maybe you want to just host a class. Maybe you have a small tribe that just, you think, wow, I know people who need to learn about this, and you want to host a class. Or maybe you're somebody who has been to several of these classes. Maybe you've already been talking to your friends or family about your oils, and you're ready to maybe even start doing a doTERRA business. We have so many different resources. We love to help people jump in where they're at and help them meet their goals.